Taoiseach, I want to know if any of the additional staff that you brought in to deal with COVID-19 are addressing the issue of the recruitment of frontline workers that we need to deal with the crisis and the conditions and pay which they have to accept. Now, I've raised this with you a few times, but really, the more I raise it, the more shocking and extensive the emails and contacts I get from people are. So, for example, I raised a number of weeks ago the issuing of widespread zero-hour contracts by CPL to contact tracers, and I've got a slew now of emails when I highlighted that scandal, which was apparently a mistake. And I'll tell you in a minute why it wasn't a mistake. But just to give you a sample of the flavour of people coming into contact tracing, who are almost all of them science graduates, by the way, important to say, issues that they have as follows: not being told if they were being paid for training, which was 11 hours so far on my part, being asked to work before being issued contracts, being treated as if we were in employment without a pay or contracts, being directed to spend our own time practicing and learning at home, zero-hour contract, a lack of human resource presence or anyone to address queries to, poor pay, 24,000 per annum, lack of sick pay and supports, though training so far has highlighted the potential of the job on mental health of the contact tracers. That's just one email from one person. But what was interesting then is I get emails from people who have been working in testing on the same contracts, also zero hour, because all the phrases that were in the mistaken contract actually have been issued to people working as medical scientists in labs doing testing since March. Again, highly qualified people on absolutely the most rubbish contracts you couldn't imagine. And then I have other medical scientists, when we're being told we need these people in the labs, who are saying they're applying for jobs and they can't get them. They can't get the jobs and they're having to sign on social welfare, even though we clearly have a testing system which was unable to function for 2 weekends because it didn't have enough staff. Yet those qualified looking for those jobs can't get them. And then there was the student nurses, which is really just the most unbelievable response. I brought up with you a couple of weeks ago, but student nurses not being paid for working on the front line in the hospitals. Do you know how many people watched the video of our engagement on that, Taoiseach? 250,000, right? And it's just a slew of comments saying, thank God somebody raised our plight. Because they're working for nothing, these student nurses. So this is how we're treating the front line. This is how we're addressing building up the permanent capacity we need to deal with COVID-19, rubbish contracts, exploiting student nurses, and not even employing qualified people who are desperate to work in the testing and tracing area. I mean, what is going on? Is there any sense of sort of awareness of this in your department and in the Cabinet subgroup? And are you going to, as a matter of urgency, address this matter? Because I don't see how we can deal with COVID-19 with that state of affairs.
In terms of the wider issue around public or the staffing and so on like that, and in terms of public service payout more generally, that's obviously the Department of Public Expenditure plays a stronger role there. Deputies Boyd Barrett and Deputy Barry really were talking about HSE in terms of how the HSE recruits staff. Since the new government came in, and I've been constantly in touch with the HSE in terms of Deputy MacDonald's point. The government came in at the end of June. Literally from the get-go, I've been working on the idea of a separate workforce for contact tracing and for testing, which the HSE and the CEO and the Minister for Health have been pushing very strongly. And we are one of the highest testing regimes now in Europe, countries in Europe, testing the highest volumes. Denmark is ahead of us. For countries over 2 million in population, Denmark would be ahead, would be next. The contact tracing side is improving and is quite extensive, but can be more extensive, and we're going to work on that. In terms of the vaccine, that will be a huge logistical exercise, and work is already underway in relation to that. You are aware that, I said earlier to the House, or in previous occasions, the European Union Commission have signed 3 agreements so far: Oxford, AstraZeneca, Janssen, and Sanofi and GlaxoSmithKline Biologics. Those 3 companies are exploring and hopefully in a position to sign off with 3 other companies, and that by the end of the year we'll have some indication as to the feasibility of those vaccine research projects and when we'll have a vaccine ready. It's going to take some time, for quite a long period in 2021 before it can be rolled out, and it will be a huge logistical exercise in itself.
Question 4, Taoiseach.
Sorry. Question 4. I last reported to the House on this matter on the 23rd of September 2020. Since then, I've continued to be in regular contact with First Minister Arlene Foster and Deputy First Minister Michelle O'Neill. I spoke with the First and Deputy First Minister on the evening of Friday the 16th of October when we discussed the evolving COVID situation. Prior to that, I had a video conference with the First Minister and Deputy First Minister on Monday the 5th of October. I had a phone call with the First Minister on Thursday the 8th of October to discuss COVID. I also spoke with the First and Deputy First Minister on the evening of Thursday the 24th of September concerning the need to introduce Level 3 COVID restrictions in Donegal to curb the rising levels of infections there. And there's also an ongoing engagement at official level on a wide range of issues between the Minister for Health and both Ministers for Health, and also clinically between the 2 health services in relation to COVID as well.